Hi everyone, thanks so much for joining us today and listening to the first episode of hopefully many to come of conversations between myself, Joe Tanzer, and Yvonne Richards. I'll let Yvonne introduce herself in a moment, but my name's Joe. I joined the BHA sexual health team a few months ago. I'm a community engagement and development worker, and I'm here today to talk to you about PrEP, what it is, how we can take it, who can take it, and how we know that it works. And there's a lot of information out there around PrEP. We're going to keep it very simple. We've split it down into these 4 categories that I've just mentioned. Before I repeat them for you, I'll let everyone introduce herself.
So, hi everyone, I'm Yvonne. So, I'm a sessional worker for BHA, but I'm also a woman living with HIV. So, I was interested in PrEP because I've learnt recently that women can take it, and I didn't know that. So, I'm intrigued to talk to Joe about PrEP, find out as much as I can about it, and then figure out how I can apply it to, yeah, any woman's life, because I think it's a really important prevention on the landscape, and I don't think women are really clued in on it. So, Joe, tell me, what is PrEP?
Absolutely, Yvonne, you make a really good point, and I'm glad that we'll get to be talking about uh, women, how women can take PrEP, because it's been there's been a lot of take up with men who have sex with men, with gay men, with bisexual men, but PrEP is available for anyone who is at risk of HIV, which, of course, as we know, is everyone. So we'll get on to that. PrEP, we're going to start the first of the 4 questions. The 4 questions are, what is it? So what is PrEP? Question 2 is, how do we know that it works? Question 3 is, how can I take it? And question 4 is, who can take it? So we'll start with question 1. What is PrEP? PrEP, it looks like a little blue pill. It's a medication. It's a pill that you can take, and if taken properly, it will protect you from HIV. PrEP is made up of 2 drugs. So it's one pill that contains 2 ingredients. The ingredients are called tenofovir and emtricitabine. They are 2 medications that are also the backbones of a lot of people's HIV medication. People who are living with HIV will also be taking this drug, and it helps suppress the viral load within their system. So they're 2 drugs that have been tried and tested for years, that are taken by millions of people across the globe who have access to HIV and are living with HIV, who have access to HIV medication. Did you want to
My
say?
experience, yeah, my experience when I got my diagnosis was that I was given this little blue pill. It's called Truvada. Um, I didn't understand the contents, but it's no bigger than the size of most aspirins, so it's not huge and it's not threatening. And what I actually liked about it was it's easy to take, because I think the joys of it is once you get into a steady routine with it, you can take it with or without food. And I like that, because if you're a person on the go and you want something that's easy to take and fits in with your lifestyle, not only is it protecting you against HIV, but it's not a difficult medication to take. It's straightforward once you're in there. And I know that you said it's got 2 elements to it, but what I wanted you to do was to reel back and just tell me, these 2 elements sound really complicated, but what are they trying to do? What is the medicine about? What's this medication about? How does it help?
Yeah, that's a really good question. HIV medication attacks the HIV virus and stops it from replicating. And it does that at 6 different stages of the life cycle of that HIV.
So it can either, my understanding is, because I call it a meatball, the HIV virus looks like a meatball to me. and it's got these little spikes on top. Then it's got the outer layer, and then it's got the inner layer, and then it's got a nucleus. And my understanding is these two medications try to stop the virus at every single point of its life cycle from entering your body, from attaching onto your immune system, from getting in, replicating, and then from replicating to moving out of your body. And so, in layman's terms, really, the medication is about making the HIV virus totally useless, either at replicating itself or attaching itself to your immune system, T cells they're called, so that it can't damage your immune system. So that's fantastic if you think about it. The science is so good that we can stop the virus in its tracks before it gets in, before it attaches, before it replicates or moves on to your body. But how do I know that's okay in my body? What's the medication doing? And are the checks that the doctors would be doing to make sure I was okay?
Yeah, that's you make a number of really great and important points there, Yvonne. So you're right. Um, we have these different types of medication that stop the HIV virus, that meatball that you mentioned, in its tracks on a number of different occasions. To get really technical, tenofovir and entrectinib, the two ingredients that are in PrEP, also known as the branded drug Truvada, which you mentioned before, they are nucleoside or nucleotide reverse transcriptase inhibitors. So when the HIV viral bit of virus attaches to the T4 cells, the T cells or the CD4 cells, basically your white blood cells, the warriors of your immune system that come and protect you at a site of infection. They clock that the HIV is there, they come to try and eradicate it, but the HIV is very clever and it ends up using that CD4 cell to produce more of itself. And it does that by injecting its information into that CD4 cell. And the CD4 cell, that information inside the CD4 cell goes through a process called reverse transcription, which means that that cell then starts producing more HIV. But if you've got tenofovir and emtricitabine in your system, in your white blood cells, that stops that process from happening.
So in effect, you're saying if I take PrEP, the Truvada,
Yeah,
I can stop the HIV from progressing in my system.
yeah,
Is that I've got that right?
yeah. So the HIV will just die. It's not able to live because of what's happening, because of these the way that you've got tenofovir and entrectinib in your system to stop that HIV from replicating itself.
Yeah. So it's almost like it wraps round, and then I when I'm thinking about it, I'm looking at that, this HIV meatball being wrapped round with this drug, Truvada PrEP, so it can't move outside of this cellophane wrapping, can't progress on, eventually suffocates and dies. So that's why it's a preventative. That's why
Mm,
if I've had unprotected sex with someone that may have had HIV, or if I don't know the status, that makes it safer for me.
mm. Yeah,
Okay.
that's a really good image. The what the science would say, because we're trying to think of how to make this simple. If you imagine instead of the HIV meatball being wrapped in something that stops it from doing something, imagine your CD4 cells, your T cells, being empowered in some way. They've got some armor on them, on the inside of them. So when the meatball attaches to it, it uses everyone has seen what a virus looks like. It's got these spiky keys on the end of it. When it attaches to the CD4 cell and it injects its information into the CD4 cell to kind of colonize it, the the CD4 cell has armor inside it that will stop that process from happening.
I'll get you. So it recognizes it already. So the game is up, kind of thing. So
Yeah.
that goes back to the question that I was asking before. So do I just get it off the internet? Do I just walk into my doctor's? How do I get hold of this PrEP thing? Because it sounds a good idea. Yeah, tell me, how would I go about getting it? What do I need to know?
Yeah, really good question. So you can buy PrEP on the internet. Websites for that would be I Want PrEP Now or an organization called Prepster, Prepster. If you Google these websites, they will point you in the right direction. It's still around £30 for a month's supply of PrEP, depending on how you're taking it, which we'll get to in a moment. However, PrEP is also available for free on the NHS. And that's a really important bit of information for people to know, that they can go and talk to their doctor, to their GP, to a sexual health nurse, and they can talk about the kind of sex that they're having, and they can talk to the doctor about PrEP, and they can be prescribed PrEP. So just like you would if you wanted to get any other prescription or any other type of medication, you can go to your doctor and talk about PrEP and talk about the ways, say that you're concerned about HIV and you want to protect yourself from HIV. You will be given a HIV test or asked to do a HIV test to just make sure that you are not living with HIV, that you are currently HIV negative. It's really important that you are HIV negative when you start taking PrEP, and that's because the HIV in your system, if you've already got HIV in your system when you take PrEP, that medication is good at tackling that HIV, but it's not enough. People that are living with HIV, they don't just take these two ingredients, they take a third one as well, and it's called a cocktail. It's a regimen that has more drugs in it to really make sure that that HIV has no way out. So once HIV has already taken hold in your system, you need to take a bit more medication than what's in PrEP. So it's important to not take PrEP whilst living with HIV, whilst having HIV in your system already, because you
Yeah,
will develop your HIV will develop resistance to the drugs that are in PrEP. And I'll just quickly say that as well as that, you will also have your kidney function monitored, and that's because PrEP is very safe. There's a lot of studies that have been done, a lot of research. We know that PrEP is very safe. The ingredients that are in PrEP are also being taken by people living with HIV, millions of people across the globe. It's very safe. Some people do experience side effects, such as nausea, but that is very limited. Um, and but
you
it is
can.
still a medication, and the clinicians will just want to check that your kidneys are able to process that medication efficiently. So you'll be asked to go to the clinic every 3 months to have your kidney function checked. And there is also a bit of research that shows that PrEP can impact the kidney function, and that PrEP can impact bone density. Now, it's about weighing up risk and thinking about what is more important to you and what's more important to your health. There is some evidence that shows that, for example, that long-term use of PrEP for people that take PrEP every day, and we'll get on to, in a moment, we'll get on to how the different ways you can take PrEP. People that take PrEP every day for a long period of time, there is some evidence that suggests reduction of bone density, so that could lead to something like osteoporosis, for example. However, when people stopped taking PrEP, bone density returned to normal after about 6 months. So it's about thinking, am I having a lot of sex at the moment? Am I able to use condoms? Do I want to use PrEP instead of condoms or as well as condoms? How long do I want to take PrEP for? Because we're not thinking that people will be taking PrEP for decades of their lives.
Not without being checked by a doctor. Because one of the things that you're saying then, when I'm weighing up the risk, when anybody weighs up the risk, is if you want to take PrEP, yes, I can get it online, but really, if I decide to go through my GP or sexual health clinic, I can get more care because they're monitoring my liver, kidney function and making sure it's working okay. And they're aware of the osteoporosis long term. So, therefore, we could have conversations and review how I was taking PrEP, which then would make it safer for me if it's something that I wanted to use, at least for the foreseeable future.
Yeah, absolutely. Really good point. You will, and that's why, although you can buy it online, it is a good idea to get it through the NHS, obviously, because on the one hand it's free, but also you will have that relationship with the clinicians and they will be able to support you. There is also a lot of information available online. AIDS Map, for example, is a really good website that will give you access to all of this research.
Okay, so just read out for me the AIDS map link so that I can find it. Um, I know my brain's a bit rusty, but if I think about it, I think is it
It's aidsmap.com, so that's aidsmap.com.
okay. And so we can find more information about PrEP. So if I want to just slow down and think it through, I can get the information, absorb it. Would I be able to have a natter if I went down to any of the sexual health services to be able to talk through? Because this sounds like a lot of information to take in. Where could I go to, just have a one-to-one with someone?
Yeah, absolutely. You can always talk to your sexual health nurse. I
Okay.
think that they would have more knowledge on this than your GP. You can also come to us, to BHA. Our email is pash, P-A-S-H, at the BHA, T-H-E-B-H-A .org, O-R-G.uk. So that's pash at the BHA.org.uk. We have a great team here of people who will be very willing and able and ready to give you as much time as you need to talk about PrEP.
Okay, that'd be great.
So let's move on now to how we know that it works. I just mentioned briefly that our knowledge on PrEP is the result of years of study. People have been taking these ingredients for many years, people living with HIV, that is, and
Definitely.
people have been using PrEP as a preventative medication. So people who don't currently have HIV and want to protect themselves from HIV.
So when did we first find out that PrEP was effective? Do you know the earliest study of PrEP as prevention? When was that done?
I'm pretty sure that it was the IPREX study in 2010. So since 2010, people had the idea. So obviously, just before 2010, we had the idea, or scientists had the idea that some of the medication that was used for HIV, people living with HIV, could be used for HIV negative people as a preventative tool. So people that were having sex and not using condoms, they could be taking PrEP and that would protect them instead of the condom use against HIV. So that was a group of men who have sex with men that took part in this IPREX study and a few trans women as well. There was a second study that was done that focused solely on trans women. That was in very kind of clinical settings. And then we had the PROUD study of 2015, which was PrEP in a real life setting.
So just wheel back because you said trans women. When was that study done?
2014.
Okay, so we've gone through 2010 on men, 2014 on trans women, and then we've had live studies. So that's real relationships where people are having sex unprotected and using PrEP, and it's been effective. No transmission has occurred. Then,
Yeah,
okay, great.
absolutely.
But I'm hearing men. So tell me, where are the women in this?
hmm Yep, that's a really good question. This is, I mean, the context of these studies was, over a decade ago. The outlook of HIV and HIV transmission was very different then to what it is now. And these studies were focusing on, what is called most at-risk populations, particularly men who have sex with men, because of the type of sex that is common, which is anal sex, and condomless anal sex, which is a high risk practice in terms of HIV transmission. The penis going in and out of the anus can cause slight micro tears, micro abrasions, that can aid the semen being absorbed into the mucous membrane of the anus, and the HIV is contained in the semen. So whether the partner ejaculates in the other partner or not, the what's called pre-cum, the semen there can transmit the HIV. So resources and efforts went into focusing on that sexual practice, those group of people. But yes, you're right, Yvonne. We are, as Manchester, as a fast track city, trying to stop all HIV transmission by 2030. We do need to be broadening our focus. I think that, one of the reasons we're having this conversation is to raise awareness, and PrEP is people in gay communities, men having sex with men. It's relatively common that people know about PrEP, know someone who's on PrEP, they talk about it. That, I can qualify that a bit by saying this is mainly white gay men, people that unfortunately, due to racism, can still feel excluded and isolated from gay scenes. The gay scene in Manchester around Canal Street, for example, they might not be getting this information word of mouth. So there is work that needs to be done there on gay men of colour, queer people of colour that aren't getting this information word of mouth like their white peers are. But yes, women might not be thinking that PrEP is something that is available for them, that's something that could help them enjoy their sex life and enjoy their sex life in a safer way, and that women who of course are at risk of HIV, as we all are, anyone, that first word in HIV is human. Anyone who is human can have the human immunodeficiency virus in their
And
system.
yeah, sorry for jumping in, but I'm only thinking as well, because when I was listening to you, when you talked about how the HIV virus is passed on, you were talking about micro tears, it's happening during sex, and a guy can ejaculate. Well, I'm thinking all of those factors exist for a woman as well. And it would make sense then when anyone is having sex and considering the different types of contraception. For a woman, it's very easy to think about pregnancy and avoiding that. So, you know of the condoms, you know of taking the pill. But for most women, they wouldn't know and realize that, this pill PrEP was available to protect them against HIV. Um, how does the testing differ for women? If a woman went in, she talked to the GP. I'm a sex worker. I'm a woman who has a lot of sex. I may be a woman who has a partner that I'm not sure of. Would those things qualify me to be able to get PrEP then?
That's a really good question. And of course, one thing that I wanted to say just before we get into that is that the contraception that is available for women, for people that can get pregnant and that might be taking hormonal treatment or using something like an implant, the conversation can very much, as you said, Yvonne, focus around pregnancy, and people don't think of sexually transmitted infections as well. So someone might think, well, I've got the copper coil, I can let someone ejaculate inside me. The
Yeah,
man, the person with the penis, if we're talking about heterosexual contact, the man can put pressure on, say, I don't enjoy it with condoms. We know that you're not going to get pregnant, so what's there to worry about? Well, of course, we know that there is HIV to worry about. Um, or HIV to think about and to protect yourself from. Um, and yes, so you're right, women are very much at risk. There are many women living with HIV. People that can get pregnant don't always think about STIs, and they take contraception that prevents pregnancy. And if they have something like the copper coil, they might think that they can then have condomless sex because they aren't at risk. And of course, it's important to also be aware of HIV. So these people can go and talk to a sexual health professional, sexual health nurse, and they can describe the type of sex that they're having,
Mhm.
and they can talk about their fears around HIV and the fact that they want to protect themselves from HIV. They're not always able to use condoms, either because they, it's a nice idea, but they always forget. In the moment they forget to use one, they really, really don't like it. They struggle getting latex-free condoms, or they're with a partner who pressures them to not use condoms, which is of course a really, really big factor. I come across that all the time in my work when I'm testing people for STIs, having conversations with them, talking about condom use, people unable to say, I want to use a condom, feeling embarrassed about that, feeling pressure to not even talk about it. So PrEP is a good way for these people to, discreetly, if they want to, protect themselves from HIV. If we're thinking of, a woman with a new partner doesn't quite trust him or feel that he's trustworthy, um,
It's new.
or he's new, or has, you know, slept with multiple people before whilst being in a relationship with you, and you think it's monogamous, and is insisting on not using condom use,
Or both of them,
or both of
not
them.
wanting a monogamous relationship. Both of them may want multiple, but it's nice to know that you can think it through, and there's that opportunity or that choice to sit down and talk it through with somebody.
Yeah, absolutely. And again, you can talk to a sexual health nurse, and you can also come to BHA, um, and think about the type of sex you're having. Um, I mentioned trust earlier, and of course, it's not always something that isn't there's maybe helpful to think about. Sometimes it's more helpful to just think you're either protected or you're not, and PrEP is one way that you can protect yourself. Um,
Great.
yeah, of- so PrEP is available on the NHS, and basically anyone who is at risk of HIV can get PrEP. Um,
Can you find that information on the internet? So, we've got the government website. That government website covers everything from Martians landing on the moon too. So, if I went on the government website, would it be on there? Would I find it there, or where can I find more information? Because you've mentioned here, BHA, we can talk to you. But if I went on the net, can I just put in PrEP, PrEP? Because you've mentioned Prepster, and
and
what was the other one
and
again?
I want PrEP
And
now.
now PrEP now. So for anyone, including women, we can go on those two websites, get more information on PrEP, get clued up and start making informed choices.
Yeah, absolutely. And I'm not aware of resources on the government website. It's not something that I use in my work, but I Want PrEP Now is really great. The NHS, if you type in NHS PrEP, you'll also get information. Just whilst we are focusing on women, I guess it's important to also stress some of the concerns that cis women and trans women might be thinking about as they listen to this, and thinking about whether PrEP is for them. If women who can get pregnant take PrEP, they can still take their hormonal birth control as well. It's safe, and both will work if taken correctly. Women who can get pregnant can still get pregnant as well. PrEP prevents HIV, not pregnancy. And you can then, of course, conceive and carry a baby, and taking PrEP is safe for both you and your baby. We have people living with HIV who get pregnant and give birth all the time. It's not an issue. You can also breastfeed safely if you're HIV negative and taking PrEP. And if you're a trans woman taking feminizing hormone therapy, it will not stop the hormones working. It will not cause fat redistribution in the body or face. And of course, another really important thing to think about is that you can still seek asylum and refugee status if you're taking PrEP. If you're talking to anyone about your sex life in this country, that is confidential and it will not impact. The Home Office will not be informed. It will not impact this process of seeking asylum here in this country. PrEP is still available to you, and as well as HIV medication
Free.
for free. Yeah. So we need to go on to this final question now of how can I take it? And the best way to think about this is to just think about what type of sex you're having. So if you're having vaginal sex or sex in the the frontal hole, then you can take you can take PrEP. That will protect you from acquiring HIV even if you have that sex without a condom. You will have to take PrEP every day. So that's one pill each day, around about the same time. Doesn't have to be, but it can help you remember it. So you have to take PrEP every day if you're having vaginal sex.
So
However,
that's like the pill.
we just like the pill, absolutely. And you could even, take it with your pill.
Oh, okay.
If you're having anal sex, if you're having just anal sex, then you only need to take PrEP 4 times a week instead of 7 times a week. So you don't need to take it every day. You just need to take it 4 times a week. So what we tend to call that is T's and S's. Tuesday, Thursday, Saturday, Sunday. Take it 4 times a week, just if it helps you remember it. But within a week, you need to have taken 4.
Okay, I get that now. Tuesday, Thursday, Saturday, Sunday. Yeah.
Yeah.
Bit teasing it.
T's and S's. If you're having just anal sex, you can also do what's called on-demand dosing or event-based dosing. And on-demand means when you want to have sex. So you take one pill up to 2 hours before you have the sex. No, sorry, you take 2 pills up to 2 hours before you have the sex. So you double dose. You take 2 pills up to 2 hours before the sex. You then take one pill 24 hours after the sex, and then another pill 48 hours after the sex. So you've taken 4 pills in total. If you take 2 pills, have sex, take another pill 24 hours after that sex, but then you have sex again, just need to extend your dosage by a day. So until you have taken one pill 24 hours after the last event of sex, and then another pill up to 48 hours after the last event of sex. So you just keep taking it. Yeah.
Okay.
This is because of the way that the medication in PrEP distributes itself around your body. In really simple terms, it hangs around the anus a lot longer than it does the vagina. So there's more PrEP for longer hanging around your anus, hanging around the rectum, that point of entry where those bodily fluids, for example, are going to come in. So they're there, waiting to catch the HIV.
That explains why women are taking it every day and the guys are only doing the T's and S's. Because I was trying to figure out how comes women don't get the choice of T's and S's or on demand. Right, okay then. That explains that.
Yeah. And so it's just how the body works. Obviously, people, women can, if they're just having anal sex, then they can,
Could they do the
then they
T?
could do T's and S's. Yes. Yeah.
Okay
It's
then.
got nothing to do with gender, sexuality. whether you're trans, whether you're not trans. It's just the sexual
Uh,
practice.
yeah, and I guess then if we started thinking in those terms, that would make more sense then, rather than it's a man thing or a woman thing.
Yeah,
So if it's a woman practicing anal sex, T's and S's then would work for me too.
yeah, yeah. So a trans man, for example, who is still having frontal sex, they will have to take PrEP every day.
Every day.
But
Okay.
if he's just having anal sex, then it's T's and S's, the same as with gay men who are having just anal sex
Or on demand.
or on demand. Absolutely. Yeah. So that's all the questions that we wanted to cover. We've been a little more than 20 minutes, which we planned, which we knew was inevitable, but that's fine. We'll cut it down a bit.
And see if we can get it to work. Yeah, it'll
Any
work.
final questions?
No, I think you've given me a lot to think about. I think as a woman, the thing that you've done for me is you've put the option in my mind now. I know this thing exists regarding HIV. And if I'm not feeling safe to have that conversation, I know that I can go to a sexual health centre or start the conversation with a GP or come to BHA or check online and start understanding what PrEP's about with the view then to does PrEP work for me and that I can still have it breastfeeding, pregnant, and I know that it's got a long-term history because you're saying people with HIV are using it already safely and women have already given birth. So no, Joe, thanks for that.
Amazing, Yvonne. You just summed it up beautifully. So thank you so much. And thanks for joining me. It's been a pleasure. Thank you.
Thank you for your time. Cheers.